Hi, I'm Jude, I'm the IPS president, and today I've been at the Yorkshire Branch Study Day in Leeds, and I just wanted to take a few minutes to talk you through some of the sessions that really made an impact to me. So firstly, I want to talk to you about a session that was led by Fiona Simon. She's from Leeds Teaching Hospital, and she presented a fantastic QI project which looks at reducing C. diff. So they had a bespoke, multi-interventional, innovative campaign using the Combi B model. So it had really strong QI methodology underpinning it. So there were 5 elements to this. There was IPC link worker training, and the aim of that was that if the link workers understood C. diff, they could then spread the message in their own working environments. There was a patient safety Padlet, so that was an online resource which had lots of resources available to them around C. diff. So if somebody had a question, they could look it up really quickly. And they had messages of the week, and the idea was that that would happen at handover, so a couple of times a day. In reality, that happened about 3 to 4 times a week. However, C. diff was being talked about, so the team were quite happy with that. And then they had rotating posters and campaign badges. She presented a whole screen of the different posters that they used. And what was wonderful was that they recognised that, you know, we get poster fatigue. So there were lots of different posters available, lots of different strap lines. One that I loved was spread the message, not the spores. And they even had a gloves off poster, which I thought was brilliant. And the sustainability enthusiasts amongst us will be really proud of that. Because even with C. diff, there are moments when you don't need to put gloves on. So I want to talk to you a little bit about some of the link worker training. And again, a lovely term that they used. They used a term called 30-minute learning bursts. So this was where clinical educators would go onto the ward, they'd look at the rotors, negotiate a time and just spend 30 minutes talking and educating the link workers around C. diff. And what they did is they used a self-assessment tool, and they checked through that with the member of staff, and then they would tailor that education to where the gaps were. So you weren't having to listen to stuff that you already knew. And then they did the knowledge, they went through the self-assessment afterwards to check, obviously do the knowledge check after. And what was presented was that every time the knowledge had increased. And within that training, they had defined responsibilities, and they had how to challenge poor practice, all ways to really empower the IPC link workers. And I think the beauty of this was then that what they called bedside conversations. So actually they would have conversations with patients, they'd have conversations with different multidisciplinary team members on the wards at opportunist time. So really increasing education of everybody. So it was wonderful. And they presented that actually over 4 months, they had a 54 reduction in C. diff, which is just amazing, isn't it? And not only did they have that sort of reduction, they also saw a downward trend in other healthcare associated infections too. So Fiona and her team are, they won an award for this. They won an impact award a couple of years ago on this. And she's publishing this. So when you see it in the Journal of Infection Prevention, do read it and look at how you can sort of implement this in your own environment, because I think this is a winner. So well done to Fiona and the team. We then had a chilling sort of reflection presentation from Dr. Muhammad Yassin. So he's a chap that's worked all over the world through COVID. So he was able to give a real global perspective and reflections of COVID, and one that I've not really heard before. So really excellent. So if you haven't heard him speak, do look out for him. It was a wonderful session. And then Gemma Cooper, she's our veterinary SIG lead. She did a wonderful session around diseases within veterinary sector. And what was brilliant is that she highlighted some of the challenges. And I think, you know, we have a lot of challenges in human health, but just unpicking sort of the different wildlife species that they have to manage. They have, like, we have financial restraints, but they have so much more in the veterinary sector. And they have no IPC standardised guidelines, something that blows me away, really. I can't believe that they haven't really. And I guess I'm looking forward to working with Gemma and some of her other colleagues to look at how the IPS can support with that. So yeah, there were lots of things, sort of behavioural stuff. Of course, you know, you think people don't comply. Well, animals are really tricky to comply with. So she really unpicks up lots of great challenges. She also then talked about some common pathogens, some of which I'd not heard of before, which are distinctive to animals, but also gave that link to how that impacts human health. Yeah, really fabulous session. And I do know that the veterinary SIG are holding a webinar in a couple of weeks' time. So I suggest if you want to know more about infection control in the veterinary sector, do look out for that. So overall, a fantastic day. I had to go at lunchtime, but I know Kerry also did a wonderful session on health inequalities. So yeah, hopefully this will inspire you to go to your local conference whenever that is set to be. And I do hope it's been helpful to you. So thanks for listening. Take care.